What if I told you that more than 2,000 years ago, a surgeon in ancient India was performing surgery? His name was Sushruta.
When we picture surgery today, we expect an environment exactly like this one: sterile fields, bright overhead lights, and an array of sophisticated monitors tracking every vital sign. But take away those machines. Strip out the electricity, the antibiotics, and the modern anesthetics. Let's roll the clock back 2.5 millennia and place yourself in an ancient Indian settlement. In this era, a simple cut could be a death sentence. Without a cellular understanding of infection, even a minor scrape sustained during a routine workday carried the immediate threat of lethal bacterial complications. Yet, operating directly within this highly dangerous environment, an ancient physician named Sushruta was successfully performing complex reconstructive procedures on human faces. Long before anyone could monitor a heartbeat on a screen, the pursuit of complex surgical healing was already thriving, driven entirely by human ambition. The patients seeking this level of care were usually victims of severe trauma. Wars, animal attacks, and brutal judicial punishments frequently left individuals with devastating facial mutilations. In ancient Indian society, the nose carried immense cultural weight. It stood as a public marker of a person's honor, identity, and standing within their community. Losing that specific feature meant facing immediate, devastating social exile. Disfigured individuals were routinely ostracized, stripped of their public dignity, and forced to the extreme margins of daily life. Reconstructive surgery served as the essential mechanism for reintegrating these individuals into the social fabric. Reconstructing the nose was the only way to reverse that exile. By physically repairing the face, a skilled surgeon could effectively return a banished person back to the living world. The specifics of how these practitioners achieved this are preserved in the Sushruta Samhita, an extensive Sanskrit medical treatise detailing hundreds of complex surgical techniques. Unlike many ancient traditions that relied entirely on theory, this text demanded strict, hands-on physical training from its students. The text details a highly specific arsenal of surgical instruments designed to cut, probe, and suture tissue with mechanical precision. Before a student was ever allowed to touch a human patient, they had to prove their competency by practicing incisions on watermelons and mastering their suturing techniques on animal leather. The requirement for students to master physical simulations established surgery as a rigorous, standardized discipline rooted in technical proficiency. The core biological challenge these surgeons faced was tissue death. If you simply cut a piece of skin from one body part and place it onto a facial wound, that tissue immediately loses its blood supply and rots. This diagram illustrates the solution. The surgeon laid a broad leaf across the damaged nasal cavity to measure the missing tissue. Using that template, they carved a corresponding piece of skin from the adjacent cheek. Instead of severing it completely, they left a thin stalk connected at the base. This pedicled flap allowed the body's natural circulation to pump oxygenated blood directly into the lifted skin. Finally, the surgeon rotated the living tissue over the nasal defect, securing it and inserting 2 hollow reeds to maintain open airways during healing. By manipulating the body's vascular mechanics, these early surgeons engineered a self-sustaining, living bandage millennia before the invention of the microscope. These reconstructive practices survived through generations of Indian medical practitioners. By the late 18th century, British observers stationed in India witnessed and recorded these successful operations firsthand. Those detailed accounts traveled back to Europe, where surgeons like Joseph Constantin Carpeaux began replicating the procedure in grand, formal medical theaters. The technique soon became widely published under the name the Indian method of rhinoplasty, forming the literal textbook foundation for European reconstructive surgery. This documented exchange recenters the history of medical innovation, crediting ancient Indian practitioners with the techniques that eventually defined 19th century European surgery. Today's plastic surgeons have access to tools Sushruta could never have imagined, from synthetic tissue engineering to high-powered microscopes. Yet the physiological rules of the operating room remain exactly the same: replace the missing tissue, preserve the blood supply, and restore the organ's function. Beyond the mechanics of the flap itself, what connects the modern surgeon to the ancient practitioner is a profound sense of empathy. Sushruta's legacy endures because he looked at a devastating, socially ruinous injury and decided it was fixable. Long before modern hospitals existed, medicine was already fighting to give broken people their dignity back.